Stop wasting money on whitening before you know this. Most disappointing results aren't whitening failing. They're whitening working exactly as it's supposed to, against expectations nobody set correctly in the first place. Teeth whitening is real, dentistry-backed science. But like any tool, it has rules, and knowing those rules before you start is the difference between walking out thrilled and walking out wondering what went wrong. Let's answer the 3 questions patients ask me most. Question 1, will it hurt? For most people, sensitivity is temporary, lasting a day or 2, and it's manageable with desensitizing toothpaste before and after treatment. Question 2, can I whiten over a crown or veneer? No. Restorative materials don't respond to bleach at all. They stay exactly the color they were placed in. Question 3. How long will results actually last? Less than people hope. Your enamel has microscopic pores that immediately start absorbing pigment again from whatever you eat and drink. The same way a freshly cleaned sponge starts picking up color the moment you use it. So without a maintenance plan, most people see noticeable rebound within 6 months to a year, because staining habits start the moment you finish, not months later. Now let's get into why all of that is true, because the mechanism explains everything. Bleaching agents, hydrogen peroxide or carbamide peroxide, work by oxidizing the colored compounds, the chromogens, trapped inside your enamel, and the layer beneath it called dentin. That's a chemical reaction, not magic, and chemistry has limits. It only acts on natural tooth structure, which is why crowns, veneers, bonding, and fillings never lighten, no matter how strong the gel or how long you wear it. The same chemistry explains sensitivity too. Peroxide penetrates through the enamel into the dentinal tubules, the microscopic channels leading straight to the nerve, which is exactly why teeth feel that sharp zing after a strong treatment. And there's a ceiling most people don't expect. Every tooth has a genetic shade limit, so whitening can't push you past your own natural baseline into some artificial paper white without it looking unnatural or requiring a restoration instead of more bleach. If your enamel happens to be naturally thin or more translucent, whitening can sometimes make teeth look slightly more gray rather than brighter, simply because you're seeing more of the darker dentin showing through, not because the whitening failed. With the mechanism clear, here are 3 myths quietly ruining people's results. Myth 1. All stains respond the same way. They don't. Yellow tone staining from coffee, tea, wine, or tobacco lifts fast and dramatically, while gray or brown staining from tetracycline exposure, fluorosis, or a tooth that's lost its nerve barely budges with standard whitening, and some of those cases need internal bleaching or a veneer instead. Myth 2. Natural remedies like charcoal are a safer alternative. They're not whitening your teeth chemically at all. They're scrubbing the surface with an abrasive, and used too often that abrasive wears away enamel, which can actually make teeth look more yellow over time by exposing more dentin underneath. Myth 3. More is always better, with no downside. Bleaching past your biological ceiling doesn't add brightness. It just raises your risk of gum irritation and sensitivity for 0 additional benefit, which is exactly the trap people fall into when one round doesn't look dramatic enough. Here's how this plays out in a real case. A patient comes in wanting a brighter smile before a wedding, has 2 front veneers from years back, and a noticeably yellow shade everywhere else from years of coffee. She buys an over-the-counter kit without a consult first, and here's what happens. The natural teeth lighten. The veneers stay exactly the same shade, and now there's a visible color break right in the smile line. The opposite of what she wanted, right before the most photographed day of her life. The fix isn't more product, it's sequencing. Assessing the restorations first, and deciding whether to whiten before replacing them or after. If she whitens first, the dentist can match the new veneer shade to her brighter natural teeth once they've settled. If she replaces the veneers first without whitening, she risks the opposite mismatch a few months later, once the natural teeth lighten on their own. Either order can work, but only if it's planned rather than discovered the week of the wedding, so everything matches on the actual day that matters. That case points straight to the 3 pieces of advice that actually prevent this. First, get a dental check before you start anything, because a dentist needs to rule out cavities and gum inflammation, since whitening gel on inflamed tissue or into a cavity causes real irritation, not just sensitivity. Second, match your method to your stain type and timeline instead of grabbing whatever's cheapest. If you're dealing with fast-responding yellow staining and you're not chasing a tight deadline, take-home trays often hit the best balance of result and comfort. If you've got an event coming up fast, in-office treatment gets you there quicker. But plan for a touch-up before the date, not the day before it. An in-office session shows a visible difference the same day, but is the start of a process, not the finish. Custom-fitted take-home trays typically need 1 to 2 weeks of consistent wear for full effect with far less sensitivity, while over-the-counter strips work slower and less evenly since they're not shaped to your teeth. Third, build a touch-up schedule from day one instead of treating whitening as a single event, because that's the only thing that makes results hold past month 6. On cost, professional supervised whitening tends to involve more upfront investment than a drugstore strip, but it usually delivers a more predictable result with controlled sensitivity, while cheaper options often mean more trial and error, chasing a result that never quite matches the picture in your head. So weigh that against your own budget and ask your own dentist what fits your case, since pricing varies by location and provider. Here's your takeaway. Whitening is a legitimate, effective tool, but only when your expectations match the biology behind it. It brightens natural tooth structure, fades without upkeep, and can't fix restorations or intrinsic gray staining. Before you spend money on a kit, book a consult with your own dentist, get your shade properly assessed, and build a plan instead of guessing. Follow Tooth Truth for more of what your dentist actually wishes you knew before you bought that whitening kit.